A clinical emergency. Diagnosis. Sepsis. A race against time. Rapid action is crucial. Every step can make the difference between life and death. Sepsis is one of the most frequent and deadliest diseases worldwide. Every year, 49 million people worldwide develop sepsis. 11 million of them die. Bacterial sepsis is one of the various forms of sepsis. But what makes bacterial sepsis so dangerous? In severe bacterial sepsis, the immune system and hemodynamic stability fall out of balance. Dysfunction in one amplifies dysfunction in the other. Gram-negative bacterial infections trigger an endotoxin storm, which in turn sets off a cytokine storm, an uncontrolled flood of inflammatory messengers. A vicious cycle that escalates inflammation, damages organs, and can be fatal. Efferon LPS precisely addresses this challenge. Multimodal hemoadsorption combines adsorption from two therapeutic approaches. Efferon LPS removes endotoxins and cytokines simultaneously. Endotoxins are adsorbed through interaction with an LPS selective ligand on the surface. Cytokines and cell debris are bound within the pores of a polystyrene matrix. A randomized controlled trial demonstrated its clinical efficacy as an adjuvant therapy, with early initiation proving especially beneficial. Patients with abdominal sepsis and septic shock underwent treatment. Hemodynamic stability was restored significantly faster. Vasopressor use was also reduced within 2 days. And the duration of mechanical ventilation was significantly shortened. Adjuvant hemoadsorption led to a significant improvement in patients with septic shock and restored hemodynamic stability. Efferon LPS can be integrated into various extracorporeal systems as a standalone solution for hemoadsorption or in combination with acute renal replacement therapy, extracorporeal membrane oxygenation, or cardiopulmonary bypass. Efferon LPS, multimodal hemoadsorption for sepsis and septic shock. And Efferon also offers a solution specifically designed for the unique requirements of pediatrics, Efferon NEO, which is also compatible with the Plas-Auto Sigma, optimized for pediatric treatment volumes. Efferon LPS, next generation extracorporeal blood adsorber.